just the mention of the word hysterectomy causes so much anxiety in majority of the people. This is because most of the women have heard these horror stories about hysterectomy and what it did to somebody from either their moms or their grandma or their friends. There are so many old wives' tales floating around talking about how horrible life is after hysterectomy. So I decided to debunk some of these myths and talk about hysterectomy. So what is a hysterectomy? Hysterectomy means removal of the uterus. Yep, that's all it means, removal of the uterus. Just because we tell you you're having a hysterectomy or we are removing your uterus does not mean we are taking your ovaries, does not mean you're gonna go in a menopause or anything like that, okay? So hysterectomy is removal of the uterus and the cervix, which is the opening of the uterus. If we're gonna add removal of the ovaries, it's called oophorectomy, and it's an added procedure, and your physician will talk to you about it. So one of the commonest thing people worry about is, am I going menopause as soon as I had a hysterectomy? No, you're not. As long as your ovaries are there and as long as they function in making hormones, you are not going to go in a menopause because we did a hysterectomy on you. So this was the question. This is the question someone just recently asked me in the office, and I'm like, let's debunk this myth. Let's talk about the hysterectomy. So as I said, removal of the uterus and the cervix is called a hysterectomy. Now, a long time ago, I remember when I was in my training, there have been times when we did something called supracervical hysterectomy, in which the cervix was saved. At that time, people used to think, oh, if we save the cervix, it's going to help with the bladder support. Oh, it's going to help with sex. It's going to prevent prolapse. But there are so many studies done since then, and it's shown that this is not the case. So now, American College of OBGYN has put a statement saying if you're doing a hysterectomy, take the uterus and cervix both. Keeping the cervix will not help you in all these conditions I told you. Plus, it will increase your risk of cervical cancer because cervix is still there. So why keep something we don't need, right? There are only few times when we do supracervical hysterectomy by keeping the cervix. One, if somebody has, say, multiple C-sections and have a lot of scar tissue around the cervix, or have bad endometriosis and has a lot of scar tissue, and removal of that cervix is going to cause complication with the bladder damage or some other organ damage, then that's the only time we decide, no, let's leave the part of the cervix there because this is no point putting the patient at risk. But otherwise, we remove the uterus and the cervix. Now, when we remove the uterus, we usually remove the fallopian tubes too. The only function the fallopian tubes had was to carry the eggs to the sperm, right? Now that you're not going to have a uterus, I leave those fallopian tubes. So we take the fallopian tubes when we do a hysterectomy. And the studies have also shown that by removing those tubes, we are actually decreasing the risk of ovarian cancer. Because a lot of ovarian cancer, they start in the tube, not in the ovary itself. So it has an added advantage of it. Now, when do we remove the ovaries? When do we make a decision to take everything out? That's the decision which is done only when you are older, and when I mean older, over 60 years old, and we know your ovary is not going to function anymore. Or say you have a genetic history of ovarian cancer or a breast cancer. If you have large ovarian cysts or tumors, or your ovaries are so damaged with the scar tissue because of endometriosis, because of other infections and whatnot, that leaving the ovaries will cause more problem than removing them, that's when we remove the ovaries. So when they are removed, it's called total hysterectomy. Total means removal of uterus and cervix. Bilateral, both sides, salpingo-oophorectomy. Salpingectomy means removal of the tubes. Oophorectomy means removal of the ovaries. Okay, only that time only we remove the ovaries. And if we remove them and they are normal, we will talk to you about managing your menopause symptoms. Now, how is hysterectomy done? It again depends. It depends upon why you are having a hysterectomy, what's the size of your uterus, do you have prolapse, do you have large tumors. So depending upon your clinical condition and of course the expertise of your surgeon too, we decide how the hysterectomy is done. The traditional way of doing hysterectomy is called abdominal hysterectomy, where you get an incision on your belly. It could be a transverse like a C-section scar or up and down depending upon how large and if we're removing large tumors or what other conditions are there. So that's an abdominal hysterectomy. Second way of doing it's called a vaginal hysterectomy, where everything is done vaginally. So you have no incisions, no scar, nothing on your belly. Everything is in the vagina. And the third way of doing it is laparoscopic hysterectomy, where you get a tiny little incisions, one around your belly button, couple around your belly button on the sides where we put the instruments from. So we start the surgery in the belly laparoscopically with the camera and we pull everything out of the vagina. So the uterus comes out vaginally, but the surgery started laparoscopically. So the laparoscopic surgery could be, we call straight laparoscopic, that's all is used, or robotically assisted laparoscopic, where we use the robot, because with the robot you can get a 3D view, a much closer view, and the surgery is much faster for a patient and also for the surgeon, so less complications. So there are different ways of doing the hysterectomy, again depending on your clinical condition. So what are the clinical conditions which can lead to a hysterectomy? The commonest reason is abnormal bleeding. Now for abnormal bleeding, there are a lot of treatments out there, medications, procedures, IUD. So if patient has tried all that and has failed, then hysterectomy is the next step. If you have large fibroid uterus or large fibroid tumors which are causing symptoms. Now just because you have fibroid does not mean you need a hysterectomy. Fibroids are benign tumors of the uterus. 99% of them are benign, less than 1% chance of cancer. So just because, and they're very common by the way, about 30 to 40% women have it. So just because you have it does not mean you need hysterectomy. But if those fibroids are causing problem, yes, you will need it. Endometriosis is another condition, same story, depending upon the stage of endometriosis and depending on your symptoms. Now, if we can manage your symptoms with medical treatment by doing some minor surgical procedure, that's what we prefer to do. But if that doesn't work, your pain is uncontrolled, it's just not responding to any treatment, you will end up with a hysterectomy. If you have large tumors, like of the ovary or large cyst, which is causing a problem, and we are worried about cancer or precancer cells in there, people will end up with a hysterectomy. Sometimes uterine cancer can do that as well, right? If you have a uterine cancer or a precancer cells in the uterus, into the cervix or the ovaries, your physician might consider doing a hysterectomy for you. Sometimes there is a prolapse of the organs, like your uterus is coming out of the vagina. It's falling down, the bladder is falling down, the rectum is like prolapsing. In those conditions, to fix the prolapse, we end up doing a hysterectomy along with the, taking care of the bladder and the rectum at the same time. So there are lots of different reasons why a person gets a hysterectomy. People say, hey, I'm done with my childbearing, I don't need this uterus, can I have a hysterectomy? No, you cannot just have a normal organ yanked out of your body just because you're done having children. That's not the reason. Number one, none of your insurance companies are going to pay for it. And number two, every surgery comes with its risk and complications. So why go through some kind of risk and complication just because you don't want your uterus or you don't want to have a menstrual cycle? There are things we can do. We can give medication, we can use IUD, we can do ablation. There's so much we can do to stop your bleeding. but you really do not need a hysterectomy. If you're having a hysterectomy, it's a major surgery. And to get a major surgery, you need a really good reason to have the surgery. So that brings me to the risk and complications of the surgery. What can happen during surgery? Now remember, surgery is surgery. Every surgery comes with its own risk and complication. The risk could be because of the anesthesia medication, the risk of infection, risk of bleeding, blood clots. There are so many of these conditions can happen just because you had a surgery. But when you have a surgery and when you're taking this organ away, this uterus sits into the pelvis surrounded by so many blood vessel nerves, and your bladder is in front, your rectum is behind. All this is in that little narrow pelvis, and we are trying to take this uterus away from it. So other organ damage is one of the risk we worry about during hysterectomy. The risks are less, they are not there, and if your condition needs a hysterectomy, I would say if the benefits outweigh the risk, then you should go for it. And obviously your gynecologist will talk to you about it as well. So one of the things people worry about is getting into menopause just because you had a hysterectomy. As I said again and again before, unless your ovaries are being removed, you're not gonna go in menopause. You will go through it when it's supposed to be a time for your menopause, whatever age that is. And for whatever reason, if your ovaries are removed and they are normal and your symptoms are bad, your physician will talk to you. There are medications out there which are non-hormonal as well as hormonal medication which we can give you to help with your menopause symptoms. The second concern I have is the sexual drive. Now your sexual drive, your libido is not going to be decreased because you had a hysterectomy. That's a myth, okay? If you are having a complete hysterectomy with removal of the ovaries and you are not on any hormones, it might decrease your libido. Yes, I agree with that. But if your ovaries are there, you're getting a hormone replacement, your libido should be fine. So talk to your physician about your concern and they will address that. The third concern I hear is that, will it feel different? Will sex feel different? No, it's not. Remember, the uterus is into the pelvis. It's inside your body. It has nothing to do with sex, orgasm, stimulation, nothing. It does not play any part in it. The orgasm or sexual stimulation is from your clitoris, it's from the vagina, it's from the G-spots. Uterus has nothing to do with it. So by having a hysterectomy, it's not going to change anything. Actually, if the uterus is causing a problem of bleeding and pain and discomfort, you're going to actually enjoy sex more because that pain and the bleeding, all that problem is gone. So if you're worried about having a hysterectomy because of these things, don't worry about it. Okay, talk to your physician about it. The other thing people worry about is the recovery time, because they have heard these horror stories about, oh my God, you'll be laid down for 2 months or 6 weeks. Things have changed, right? With the new research, new technology, the way we do surgeries. Hysterectomies are outpatient surgeries now. Now, I'm a laparoscopic surgeon. I do most of my surgery laparoscopic, robotically assisted. So my patients, I'm just talking from my own experience, my patients go home the same day. In few hours, literally after surgery, they're out and about the same week and they're back to work in 2 weeks. Because you have smaller incisions, the healing is faster. Now, if you had an extensive surgery, had an abdominal incision, yes, you will stay in the hospital for 1 or 2 days. Your recovery will be longer. But again, it depends. The recovery really depends upon who's doing surgery, how the surgery is done, and what happened during surgery. So recovery changes. For majority of the people, though, it's a shorter and a quicker recovery. So there are so many myths associated with this surgery. I just want you to be able to talk to your physician, ask them questions, find out how you're having the surgery and get them answered instead of getting anxious about it. If you have more questions on this topic, or if I haven't touched on some of the things you have concerns about, message me. Just leave me a message down here, call my office, email me, and we'll talk more.